for her hopes and dreams still stand, shoulder to shoulder, a precious reminder of experiences yet to come. So, wherever your moments and memories take you, let her sense of adventure set you free. She is Saint Lucia. Let her inspire you.
Welcome viewers, thank you for joining us at NTN this afternoon. My name is Naomi Grandison. I am a family life educator with the Bureau of Health Education. And today I will be hosting this panel discussion on vaccinations. 2.5 million lives are saved every year. How? Through vaccinations. As we observe Vaccination Week in the Americas, our guest today will give us some insight and key factual information about immunization across the lifespan. We do hope that this information can help us adopt a more reasonable approach to vaccination. Let me introduce and welcome our honorable guests this afternoon. We have with us Dr. Glensford Joseph. Dr. Joseph is the Medical Officer of Health on Island and the Health Disaster Coordinator. In his capacity as Medical Officer of Health, he serves as a Senior Medical Officer, providing technical guidance and direction to the departments at the Ministry of Health. He does so in collaboration with the Chief Medical Officer. Dr. Joseph has served as a District Medical Officer for over 10 years, and prior to that, as an emergency room doctor at the Victoria Hospital for 7 years. Throughout his journey, as a medical professional, Dr. Joseph has remained passionate about improving health outcomes via public health education. Welcome, Dr. Joseph. Thanks for being here with us.
Thank you. Thank you for having me.
We also have with us today Nurse Tekla Jabatis. Nurse Jabatis serves as the National Immunization Manager and the Assistant Principal Nursing Officer within the Community Nursing Department at the Ministry of Health. She has a wealth of experience as a registered nurse. Nurse Jabatis worked at St. Jude's Hospital for over 7 years and subsequently as a community health nurse in Region 5. She has a master's in public health and was promoted to Assistant Principal Nursing Officer in 2017, after which she was appointed the Immunization Manager for the island. She is very passionate about protecting the health of people and their communities. Thanks for joining us, Nurse Jabatis.
Thank you, Ms. Grandison.
We have with us also Dr. Olube Misola Ogunlusi. Dr. Ogunlusi serves as a community pediatrician covering the entire island. Prior to this, she worked for 11 years on the pediatric ward at the Victoria Hospital. She is a member of the National Immunization Committee, a member of the Sickle Cell Association, and is actively involved in a multidisciplinary team comprising of Ministry of Health and Ministry of Education that provides assistance to children with special needs. She is also an advocate for children as she liaises with the World Pediatric Project on behalf of children in St. Lucia. Dr. Ogulunsi completed her studies and training in Nigeria and worked as a pediatrician there before coming to our beautiful island. Welcome and thank you for being here with us, Dr. Ogulunsi.
Thank you very much.
Welcome. It is my honor to be here today to start this discourse on vaccination because it is a topic that is affecting a lot of us on island. And it is an opportunity for us to get the right type of information about vaccinations. Without any further ado, Dr. Joseph, when we hear the word vaccine, there might be quite a bit of confusion. Can you start by telling us what exactly is a vaccine and what is the process like for producing vaccines?
Thank you, moderator. As you rightfully indicated, that we are in the Vaccine Awareness Week, and it is important for us to really understand the whole concept of vaccine and vaccination. While we're going to have more of the importance of vaccine, I will go to your question as to what really is a vaccine. A vaccine is a biological preparation that provides active immunity to protect against certain infectious diseases. It is a safe and effective way of protecting lives and livelihood when it comes to certain infectious diseases. To date, there are several types of vaccines that protects us against some 20 or more type of infectious diseases. And these vaccines come in various types. Some of them are made from the killed or inactive organism, whether it is the virus or the bacteria.
Right.
Or they're made of components of the organism that cause the illness. When we get a little closer to St. Lucia, we know that we are going through this COVID-19 pandemic. We can take the AstraZeneca vaccine, for example,
Right.
which is really an inactive adenovirus combined with the gene that produces what is called a component of the COVID-19 virus, the spike protein that actually causes a lot of the illness associated with this disease.
So what I'm hearing you saying is that the AstraZeneca vaccine does not contain the COVID-19 virus.
No,
Okay.
it's a component of the virus.
So it contains, you said, an adenovirus, which is similar to what causes the flu, and that has on it the actual protein spike similar to that of the COVID-19 virus.
Actually, what the researchers did is to modify what is called a chimpanzee adenovirus
Right.
that will not infect the human. And more so, they would have removed that component of the virus that allows it to replicate or multiply. And as such, in that virus, they would have incorporated the gene that produces the spike protein. So what happens is that once you're given the vaccine, the body utilizes the gene to produce the spike protein and give the body a sense as if the COVID-19 virus is there.
I see. So tell us a little bit about that immunity. Like, you know, in terms of the AstraZeneca, how much immunity will somebody have, or how long will the immunity last after your body responds? Or tell us a little bit more about the immune response after you take the vaccine.
Okay, very good question. Once you would have received the vaccine, our body has what is called an immune system that really is like the army of our body to defend against infectious processes, among others. Anything that is foreign to the body, like the COVID-19 that gets in, or once you start with the vaccine, it sees it as a foreign body, and it mounts a response whereby certain cells in the body multiply and also produces certain substances which we call antibodies.
Right.
As such, the body tends to have, like you have a brain with your memory. The immune system also has memory and produces what we call memory cells, right? And these memory cells would be there for some time and would respond if the body is exposed to that organism again, and it would be primed and ready to defend very quickly. So for instance, you have been vaccinated.
Right.
Your body responds producing these memory cells and the antibodies. And at this point, we are yet to learn how long these antibodies would last. Because remember, COVID-19 is ongoing. The vaccination process has recently started. And so you will have to wait as they continue to monitor the level of antibodies to see how long it actually lasts.
Right.
But what we do know is that it is there for beyond 6 months based on, well, it's there. And also,
so the immunity has shown to last at least beyond 6 months in terms of the COVID-19 AstraZeneca vaccine.
yes.
Okay.
And so that if you're exposed to the true virus, the COVID-19 virus, the body would quickly recognize it and produce more of the antibodies, more of the cells, and quickly kill the virus as it enters the body.
Wow.
So what it actually does is prevent the virus now from multiplying and infecting many of the cells in your body, and preventing you now, or protecting you from developing symptoms, protecting you from developing the severe form of the illness.
Right.
And as such, it reduces your risk of hospitalization and death from COVID-19.
Thank you very much for that, because some people out there may think that the COVID-19 vaccine is a cure, but what you're saying is that it is it helps your body to develop the antibodies to protect you against the virus in case you come in contact with it. Thank you so much. Dr. Ogunlusi, as a pediatrician, how would you say vaccines play a role in the overall health and well-being of infants, toddlers, and children?
Oh, vaccination has been one of the major roles in disease prevention, which is a key, a vital thing in public health and in children generally. Thanks to vaccination, there are some diseases that we know of in the past that we don't hear again, and the possibility of them coming back is very rare. So we can say that vaccination has helped to eradicate some diseases. Take smallpox, for example. In some decades ago, this is a devastating infection. But thanks to vaccination, this is no more. It is something of the past. And even the ones that we have now, there are many infections that we can say with vaccination has been eliminated. It may not be totally globally eradicated, but in most regions of the world, we don't see them again. For example, measles.
Right.
Yeah, though we still have some areas where the measles still occur in pockets, occurrence, but by and large, in many places, we don't have measles again. And this is just the effect of vaccination. And I want to chip in with measles here that is why we are stressing vaccination, immunization, so that we don't bring this disease, this infection back to, our community. Another example that I want to mention, especially in children, is Haemophilus influenza. This is a bacteria that causes invasive disease in children with severe complications like meningitis, you know, severe infections in the newborn. We don't see that again. We don't see that again. It's very, very rare. And even when a child has that kind of infection, you know, it is mild, is in the mild form. We don't see those complications again. So we can say vaccination has eliminated. Talk about controlling morbidity and mortality. Even where the infection still occur in the children, it is, you know, it is mild. We don't have those severe cases. And complications that result from those infections, the doctors of the past will know about congenital rubella syndrome. We don't see that again because we immunize everybody from rubella. Even though you may still have a mild case of rubella, but you don't see the severe form again.
So you mentioned morbidity and mortality. Can you tell us a little bit of what it means? Because, you know, some of our viewers may want to know.
Okay, mortality refers to the number of deaths, you know, resulting from a particular disease or infection, while morbidity talks about the effect on the body, the severity, maybe the complications that result from it. Yeah, that is morbidity. So with vaccination, both of these have reduced. And even apart from that, talking about society in general, you know, vaccination is very, very effective. It's been found to be cost-effective, a cost-effective mode of disease prevention. You know, it is much more cheaper to vaccinate all the children than to treat the infection when it occurs. So to the government, to the society at large, it is effective. And we also talk, I'm sure many people will heard, or we keep saying herd immunity. When a certain percentage of the population is vaccinated, is immune against a particular infection, they serve as a protection to all the people who maybe for one reason or the other, maybe because of their illness or because a newborn, a baby who cannot be vaccinated, they protect such people from that infection because their presence in the community does not allow that infection to spread. So we say we have herd immunity with that. And there are so many other important advantages of vaccination.
What I'm hearing you saying is that vaccinations can really help, you know, to save lives, to save money, to reduce the burden on the healthcare, as you've seen with the children in your practice. And for this vaccination week in Americas, we also want to bring to the fore that we do have the vaccines for the children, and persons need to continue checking on vaccinating the children, because there's so much talk about the COVID-19. Sometimes it may be in the back burner, not in the forefront of our minds. So let me move to Nurse Jabatis. Nurse Jabatis, tell us a bit about how the vaccination program is administered on island and some of the challenges you have faced and some of the successes you've achieved.
Thank you, Ms. Grandison. So just to put things into context, the National Immunization Program in St. Lucia is about 44 years old. Started off in 1977. At that time, very few vaccines were administered. It's a program that started with just DPT, polio, and BCG being administered. Of course, this program has grown over the years, and throughout the years, we have introduced many more vaccines into the national program. The program, too, has yielded many successes. The program, of course, is being offered across the island. For us, it's about accessibility to the service. So the program is offered at all wellness centers across the island, as well as private pediatricians. So we work with about 6 private pediatricians who also offer the service. Beyond just institutions, we also do vaccinations at schools, and as part of the vaccination program, we engage in community outreaches, house-to-house, vaccination sessions, etc. For us, I must say that the program has seen many successes throughout the years. I mean, when the program started, you had coverages such as like 40%. That's
right.
Back in, you know. We have seen over the past 10 years where we've seen increases in our immunization program. And for us, it is you know, it's really a good thing to see that, you know, we've maintained vaccination coverage of approximately 90 to 99%.
Wow.
You know, in the various antigens. Of course, we have some challenges, and I will continue to say that our challenges is more or less with the over 1-year-olds. This is when we tend to see a decline in the coverage for various reasons. You know, some people feel after a child has passed a year, it's almost like for them they're out of the woods. You know, they tend to kind of be a little late. They tend to be a little laid back at that point. But of course, we've noted it as a I won't say a gap, but something of concern. And for us in the program, we continually monitor, evaluate, re-strategize to ensure that we sustain and we maintain the coverages, the recommended coverages. I have to say that over the years, we have seen increases, steady increases in the coverages in our over 1-year-olds.
Oh, that's nice.
Yes, very. Over the years, we have introduced newer vaccines. Of course, we offer the seasonal influenza vaccine.
Right.
To our at-risk population, our elderly persons with chronic non-communicable diseases. The hepatitis B vaccine at birth, whilst the hepatitis B vaccine has been part of our pentavalent vaccine, what some people would say the 5-in-1, one of the vaccines that our under 1-year-olds receive, but we had not been administering that vaccine at birth. While some countries started way, you know, a couple years back, but we had not. But in 2018, we introduced it. All of this towards elimination of mother-to-child transmission of hepatitis B. One of our latest successes is also the introduction of the human papillomavirus vaccine as a cancer prevention strategy, and this is offered to our grade 6 boys and girls.
Right.
We know of the burden that cervical cancer, you know, can cause on our population, and as such, we thought it was important to introduce this vaccine to that target population. And of course, one of our newest successes is the introduction of the COVID-19 vaccine, which we rolled out in February of this year.
Wonderful. So basically, we've always had a structure and a program in place for, you know, procuring vaccines and administering vaccines to the population. So when we were faced with COVID-19, then that particular structure and program was already there to absorb and to help to facilitate the dissemination to the community. So it's good to know that, you know, this is not new.
No, it's not.
Yes, the Ministry of Health has already been going through the process to ensure that our people are safe from a number of conditions. So, Dr. Joseph, I've heard some persons mention that why is the AstraZeneca vaccine a 2-dose? You know, but from your experience as a doctor, are there not vaccines, or even as a nurse yourself, Nurse Jabatis, are there not vaccines that have been given before that are more than 1 dose?
Okay, it's a very good question. And this will depend on the findings as the researchers conduct the various studies to identify the impact of the vaccine or of whichever drug on the study is on the body, the impact on the body, and that would allow them to determine whether they need to modify the dose or the frequency. For instance, we have seen during this COVID-19 pandemic the development of several vaccines to manage COVID-19. And we recognize that we have one, the Johnson & Johnson, that requires a single dose administration.
Right.
While we have the others, such as the Pfizer, the Moderna, as well as what we are presently using in St. Lucia, the AstraZeneca, requiring 2 doses to bring about the desired immune response to protect against the virus, COVID-19 virus. What they would have found in the early stages of the development, because first of all, with the development of the vaccines, they would have taken them through a series of stages, such as preclinical, where they conduct studies on animal to ensure some level of safety before they introduce it to the human population. Then at that point, they would have gone through the phase 1 clinical trial, where they conduct the study on a small number of persons, less than 100, healthy persons, to determine, one, the doses of the vaccine that is needed. You know, they tend to establish a minimum and a maximum, and then they try to strike a balance as to what is required to produce a desired effect.
Okay.
Also, they try to establish the safety of the vaccine. Here we're talking vaccine, as well as the efficacy or the effectiveness of the vaccine. So these are all areas they looked at when producing the vaccine. Now, after the first dose, they would recognize that the body's immune response would, move to a certain level in terms of the level of antibodies being produced, and would recognize that if they gave a second dose, then the level of antibodies or the immune response is even more robust.
Right.
And so that if one dose is going to give you some, let's say, 60% or so efficacy or effectiveness, then priming that response with a second dose would allow you to get to a higher level. Now, with the AstraZeneca, we have seen that the second dose would allow us to have some 70% or so level of efficacy, or you're reducing the risk of developing the severe form of the illness, that is, by some 70%.
Right, right.
Also, what you find, you can cross with other vaccines, such as the Pfizer vaccine, where they recognize that administering the second dose would take you up to some 95% of efficacy or effectiveness. That being said, coming back to the AstraZeneca, also what they have found is that initially they provided a recommendation of administering this vaccine some 4 to 12 weeks interval.
Like
and
after,
so
the first, after the first dose,
after your first dose,
you take the second dose between 4 weeks to 12 weeks.
Yeah, but as they further review the data, they recognize that it is best to have the vaccine taken between 8 to 12 weeks, and closer to 12 weeks, you have a more robust response.
Okay.
So you would recognize that in our initial rollout with the first set of recommendations, some persons would have had a vaccination interval that is returning for your second dose at 6 weeks. Some persons would have had it at 8 weeks. But in reviewing the guidelines provided by the World Health Organization and other renowned bodies, we then upgrade our interval from that 6 weeks period, bringing it to 8 weeks and
10 weeks.
And then as we move on to 10 weeks. So you would find that persons who would have received the vaccine in the initial phases of the rollout would have had a change. And this change would be announced in terms of your time for having the second dose through the immunization program, where you have the immunization manager and the rest of the team is going to announce your new dates and guide as to where you can access the vaccine.
The vaccines. Thank you very much, Dr. Joseph. Dr. Ogunwusi, can you give us an example of a vaccine in childhood, a childhood vaccine where more than one dose is required?
Okay, we have quite a few of them. Let's start with the pentavalent vaccine. That is the one we say 5-in-1.
Right.
And this contains vaccine for diphtheria, and we have the one for pertussis, which is whooping cough.
Right.
We have for tetanus in it. We have the Haemophilus influenza B, and we have hepatitis.
That's quite a few.
Yeah, 5 of them. So we give the children at least 3 doses at the age of 2, 4, and 6 months. And even later in life, like at 4 years, we still give a repeat of the diphtheria and tetanus. And so even sometimes later at the end of the school year, we repeat that. Okay.
Well, it's good to know that this is not new. Vaccines have, a lot of vaccines that we are aware of in childhood require more than 1 dose, as a matter of fact. Some 3 and some additional doses for boosters, so that you can get the optimal amount of immunity, or as we would say, defense against a particular condition.
And so even for adult vaccination, we have the hepatitis B vaccine, which is 3 doses.
Oh, wow. So we also have the adult vaccination that's 3 doses. So it's not new, and I just want to bring that point across for the public to understand that sometimes we get all this anxiety and we hear so much information, but the truth is different on the other end. So give us an example of some. Okay, for me, before I get into that question, this word side effects can really be heavy on the minds of persons. When we hear side effect, we get a fear response, we get an anxiety. And I mean, what I understand a side effect to be is something uncomfortable or feeling ill in some way after you take a particular substance, whether it be a medication. Now, it would be called a side effect because it was researched. But I could say if I drink coconut water, that increases my urination, or if I eat garlic, I would get bad breath, and we could slightly say that's a side effect, but this is not to minimize that there are some harmful side effects with certain medications, etc. But Nurse Jean-Baptiste, can you give us an idea of the AstraZeneca? What are some of the mild side effects that you can get from the AstraZeneca?
Well, as you said, with any drug or vaccine that you take, there are side effects that are likely, that may occur, may or may not occur. Some people will receive vaccines and they are perfectly fine, whilst others would experience either 1 or more, or sometimes almost every side effect.
Right.
Yes, so with the AstraZeneca vaccine, according to the research and according to the trials, when they went through the trials, some of the side effects that they noted were the pain at the injection site, fever, chills, body pain, nausea, headache, the feeling tired, malaise. And since our rollout of the campaign, we seem to be seeing, what the side effects that are reported seems to be very similar. So we get the reports of the malaise, the pain
when
in
you
the
say
injection
malaise,
site.
when you say malaise, what do you mean?
This sort of ill feeling after you would have received the vaccine. So
almost like when you have the flu.
Well, that's right.
Sense.
Yeah,
Okay.
this sort of ill feeling.
Right.
So many people complained of feeling tired, especially the day after, the headache, the chills. Of course, all of this is because your body is responding. Your body is responding to the vaccine. What we've noted, though, is that many of these side effects, they go away within 24 to 48 hours.
Okay.
So in a matter of 2-3 days, people are feeling fine again.
They're pretty much back to normal.
Of course, you know, you have a part of a population, persons who understand that this is a side effect, and it is that, you know, their body is responding to what, because obviously some people understand how vaccines work better than others. You have some others who, for them, they feel sick. And, you know, we have, as healthcare workers, we have to continually reassure them and educate them, help them understand, you know, this is the vaccine working, and that, you know, it will go away. But
I'm happy you brought that up, because I was just about to ask Dr. Ogunlusi, why is it that if you take a vaccine, you get, well, almost every vaccine, pretty much, that there are similar side effects. Let's say, for instance, the fever, the tiredness, the pain at the injection site, sometimes headache. What is really happening in the body that may be contributing to some of these effects?
Okay, like she said, side effects are undesired effects from a particular substance, whether a medication, a drug, or vaccine. And most of the time, we know, the physician know that these will occur, right? So for the vaccine, those side effects are the result of the reaction of the vaccine in the body, because as it's inside the immune response to produce what Dr. Joseph said, antibodies and some cells, there are also some old innate response that will be incited, like production of cytokines. So we know when anybody gets a vaccine, those will be incited too, and those are some of the things that will cause the fever, the headache, you know, the feeling unwell. So usually it accompanies all of those vaccines, and the physician will prepare whoever is taking that you may feel this and you may feel that. And we see that with other drugs, with medications. In fact, sometimes we use the effect or the side effect as a benefit to the person. We use that method in some drugs. You know, this drug will give a side effect, and I want that effect in you, say drowsiness, sleeping. The common medication we use, the multi-symptoms, they'll say in the night, because it will make you drowsy, and we want you to have a good sleep in the night, so we prescribe such.
So what I'm hearing you saying is that the response that the body is having, the immune response, the body is defending, is releasing antibodies, and when the immune system is stimulated, let's say by the vaccine, then there are things that will happen, because the body is almost thinking like there is a foreign substance in there. So it will raise the temperature as a way of fighting or preparing and releasing. It will drain you because it's taking energy. It might give you some aches. So in a sense, we're saying that you might be feeling a little sick to get better. So with that, we will go ahead to our first break, but please stay with us. We'll be right back to continue to discuss vaccinations.
Cette lisi ka registre vermin corona ek I ka fait mouvement ek an chay vitesse tan. Chaque canef ka kouye pour vigilance publique là fait wolo parler en place publique qu'on bol en main base ti boutique changer distance sociale 6 pieds hod yon à l'autre I ka travail tan si ou senti ko pas cordial quarantine ko pas en contact et puis l'autre en cas où tu es exposé. C'est un écuyer, free one ou ben n'importe clinique qui est pour les pays à 10 000 à clé, ça veut dire les supermarkets, pharmacies et puis ATM, yo accessible avant cette souhait. Pays à clé en plein, ça veut dire tout bagay fermé à 24 heures. Servi protocole comme sorti par bureau indication santé. Nous tout ensemble, ça sauver vermine corona. Si nous tous servi Jidla à toutes les.
Together let us win this war. Say to shall be a soldier. Together we can beat this corona.
Hi, welcome back to our panel discussion on vaccinations. My name is Naomi Grandison, and we are here with some esteemed panelists today, and we will continue the conversation. And we are open right now to receiving calls, questions, comments on the platforms, and also via telephone at 468-2162. That's 468-2162, so you can call us and ask questions. I will ask Nurse Jean-Baptiste, some people have been asking what is in place if they experience any side effects or, I would say, adverse event after taking the vaccine. If the 2 days are passed, say for instance, and it starts to linger or the symptom is very, very bad. What's in place for these persons? Can you shed a light on that?
Okay, so just before our break, we were speaking about the side effects. And whilst generally most of the side effects that people would have reported are generally mild and would go away within 2 to 3 days, but we also know that there are undesirable events, that may occur after someone receives a vaccine. A drug, but since we're talking vaccine, I would say vaccine. And it could be, either hospitalization, a sign, a symptom, something that persists a little longer than expected. It could be, even a laboratory finding, a disease, a sign of symptom. And of course, as part of the national immunization program, there is an established system for monitoring of such. So we often encourage persons, once you would have received or experienced any symptom or anything undesirable after you would have received the vaccine, to report to your healthcare provider. Whether it be you or a family member in a case where you can't do it yourself, but it is very important to notify your healthcare provider that you are experiencing something.
So that's a private doctor
yes.
or at the health centers or wellness centers across the island?
Yes, your nurse, your private doctor at the hospitals. As part of, and it's not just the COVID-19 rollout, it has existed. There are what we call adverse event reporting forms. So when somebody would have reported an adverse event, it is the details of what you're feeling, the details of the event would be noted to the person that you're reporting. Of course, once we have been notified, that would be, the reporting goes to the other level. So the EPI manager is informed.
The EPI?
The immunization manager,
Okay,
expanded
thanks.
program of immunization.
Okay.
So the EPI manager is informed, and of course, other persons on the vaccine committee. Once we have collected this information surrounding the event, of course an investigation is launched.
Okay.
And the purpose of the investigation is really to determine, to analyze the data that we have collected. So we would collect as much detail as possible surrounding the event, the person, drug history, medical history, etc. All of this is in an effort to determine causality, to see what exactly would have caused the event. Because even if you're experiencing something after you would have taken a vaccine, it does not necessarily mean that it is the vaccine that caused it.
Right.
So hence the reason why it is important for that detailed investigation and assessment and causality assessment. At the end of the day, whether it is linked to, whether we find that it is linked to the vaccine or not, that in itself is we provide feedback. So we would provide feedback to the client. Okay, we found X, Y, Z. It seems that it was related to the vaccine that you took or not. Now, the next question, and your question is, what is in place?
Right. For instance, I don't mean to distill, but let's say somebody continues to have these pounding headaches and it persists, when they go in, for instance, to the nurse, would the state take responsibility to care for them?
So this is what I'm coming to.
Okay.
So as part of the program, and of course, as such, I speak of the COVID-19 vaccination. There is what we call an indemnity agreement.
Right.
That makes allowance, or should I say, well, is allowance the correct word? But it makes
creates a possibility, should we say?
Provision.
Provision. Provision is the word that I'm looking for.
Right.
It makes provision for persons to claim. But of course, that is after this process that I just spoke of. This is after it has been, you have determined what the cause is. Once after that causality assessment, so if it was indeed as a result of the vaccine, then that indemnity agreement does make provision for that. Of course, in some cases, the state would take liability.
Right. Like if the person is sick, the person goes into the hospital, the state will care for them in the interim. Like they're not feeling well, Dr. Joseph?
Okay, thank you.
Oh, just one thing. Somebody asked a question on our platform. How about if you had the virus already, do you still need to be vaccinated since you already have antibodies? Go ahead.
Thank you. I can take that question as I move on to further explanation. But directly to that question, the answer is yes. Once you've been infected by the COVID-19 and you would have recovered, you would no longer be in isolation. You are eligible. And again, once you're 18 years and older, you're eligible for the AstraZeneca vaccine. And as such, we'd say COVID-19 vaccines.
Right.
Because one of the things they have found is that by 6 months after your infection, the amount of antibodies in your body would have dropped so significantly that you are at risk for a second COVID-19 infection. As such, you are recommended to have the COVID-19 vaccine in order to boost your immune system and to give you a more robust protection against COVID-19 in the future.
Okay, wonderful. Okay, so it's important that persons, even if they've had COVID-19, to still take the vaccine after they've recovered to ensure that they have that additional protection. Okay. Yes. And following to the question I had asked previously, if somebody were to, let's say, continue having headaches or whatever it is, symptoms they're having, if they go into a state facility and they indicate that they had taken the vaccine and they never had these symptoms before, would they be cared for by the state?
First of all, spinning off from what Nurse Jabatis indicated, the indemnity agreement that allows for coverage of persons who may be or would be impacted by what is called the adverse event after immunization. All right? Definitely anyone who presents with symptoms that are beyond that 2 days, as explained earlier, the mild symptoms need to be evaluated by a healthcare professional. More so, if persons tend to have, as you mentioned, severe persistent headache, if persons have a chest pain, shortness of breath, abdominal pain, pain in the legs and swelling, these are symptoms, signs and symptoms that those persons need to and must present to a healthcare provider for evaluation and for the management.
Okay.
Because we do know while many of the symptoms or what we call side effects are mild and actually indicates that the vaccine is working, some persons may have, and that is very, very rare, the more severe side effects which have been reported over the past month or so that really impacts the uptake of the vaccines and more so the AstraZeneca vaccine.
I'm happy you brought that up because I was about to speak to some of the misinformation or myths as it relates to vaccine. And one of them right now is that the AstraZeneca vaccine is a high risk for blood clots. When people speak about the AstraZeneca vaccine, some of them said, "Oh, it's high risk," you know. Can you speak to that? Well, anybody in the panel, or
I can start the discussion and be.
Okay, excuse me. We have received a call, so we'll get back to you with that question. Thank you for joining us. Please go ahead, ask your question, caller.
Hi, good afternoon.
Good.
I've been listening. I took the vaccine on March 12th.
Okay. I'm not hearing you clearly. I'm not sure if what I did here is I took the vaccine on March 12th.
Yes, and since then I've been having adverse effects
Can we get some assistance?
I've had to be hospitalized. Well, I've been in and out of the hospital since then. Chest pain, shortness of breath. There's a point where it actually felt like I was paralyzed.
Wow.
Headaches, to the point where the doctor actually had me do a CAT scan, and I was seen as CH and OH, and I was billed both times. I did not feel like I got any, I would say, priority.
Okay.
Because I came in 4 o'clock in the morning on an ambulance, and I had to wait 4 hours before I see a doctor. When I went to the same way, I had to wait hours before I see a doctor. The last doctor I went to did not even know that anyone is having adverse effects to the vaccine. The state will be responsible. She said she didn't know anything about that. I have been to so many different doctors, and prior to taking the vaccine, I was healthy. I had none of those symptoms. An investigation has started. I would say that on my case, 2 weeks after I took the vaccine, is now 7 weeks, and I haven't heard any. Well, I won't say I haven't heard anything, but I guess the investigation is still ongoing. But I still have the symptoms and I basically feel like I'm dealing with this on my own. I'm not getting any assistance from the healthcare. Yes, I took the vaccine willingly. I understand that.
Okay.
But I haven't been able to walk a long distance because of the shortness of breath, the dizziness, the lightheadedness. I haven't been able to go back to my normal routine. Simple things like taking a long shower or anything. I need assistance to do everything. My bills have gone past $5,000 already from seeing doctors, doing all kind of tests, and I just feel like the state have left me alone without any kind of assistance. I have been sick every single day for the past 7 weeks, and going to the hospital, all they tell me, they fill out the form, and they tell me it's an adverse effect to the vaccine. There's nothing they can do. They send me home, and then I'm being sent home to do what? Wait on a miracle? I do not know. I'm just trying to find out what it is that I don't know. I'm just seeking answers because I'm just left hanging.
Caller, thank you so much for calling. I'm really saddened to hear your situation. I do wish you full recovery from what you are experiencing. I don't know if any of the panelists want to speak to that or respond. Okay.
Thank you. Thank you, caller, for your input into this discussion. It is important for us to know, as you rightfully said, persons who would have received a vaccine, and more so here we are using the AstraZeneca vaccine, can have side effects many of those side effects, most of those side effects of varying degrees. Some persons may not have any symptom at all, while others may have just a localized tenderness at the point of injection. And some other persons may have more what is called a systemic illness, whereby the fever, the chills, the malaise, some level of weakness. Some persons may very well have a headache that goes along with the vaccination process. One of the things we also note is that of the difference when we look at side effects as against what is called adverse reaction following immunization. What we have seen thus far is that while we acknowledge that side effects and very rare adverse reactions are likely to occur, this is, like as pointed out earlier, any of the medication we may take. What we have seen is that over the months since the introduction of the COVID-19 vaccines, and more so the AstraZeneca that we are dealing with, several millions of doses have been administered, and the number of persons who may have the more severe or towards that severe extreme of side effects are very, very, very rare. Okay. And they continue, according to the World Health Organization and other renowned bodies, that the benefit of vaccination against COVID-19 far outweighs risk. That is not to minimize the side effects that anyone may be impacted with. Right. Because when you look at the overall impact of COVID-19 on St. Lucia and the world at large, and if you look at some of the other countries where the vaccination drive was not as aggressive, where persons did not adhere to the public health measures, they actually have overwhelming of their hospital system, whereby they do not have adequate space, they do not have adequate oxygen, and persons are dying every day, increasing numbers. And we acknowledge that vaccines are very, very important, as a very important tool in helping to reduce the risk of COVID-19, to reduce the social and economic impact on COVID-19, so that we can return to that level of normalcy. What we do, and we will follow up with the cases to ensure that we have a little more visibility, a little more hands-on, to ensure that the necessary investigation are being done. And one of the important things of any side effect that has been reported is investigation, investigation, right. Investigation. That is critical to determine whether there is an association or whether there is causation of the vaccine, and this is going to be ongoing.
Okay, thank you very much for that input. I as a health professional myself, I'm always very concerned about the overall well-being of the population. And although we do know that the vaccine definitely, the benefits way outweigh the risk, and it's a very small percentage of people who may get, what I would say, an adverse event of concern. I would think that the ministry or the government would have something in place, because just like we know in the States, they were able to arbitrarily find out that there were some persons who were complaining about the possibility of, clots and so on. These cases were investigated, and those persons would have had to be followed. And I'm hoping, giving support, because I'm much of an advocate. So I think even if there's still a possibility, even if it could not be the vaccine, but there's still a high possibility that it could be the vaccine, even if it's 1 out of 1 million. So I would always think that the state would be very supportive in dealing with any case or possibility at all, whether it ends up being yes or no, right? So I just want to continue on. I hope persons are listening and they are coming in and asking questions. I am checking the platforms. So moving along, there's apart from this concern that Dr. Joseph has expressed, the benefits way outweigh the risk. I know from my latest reading that out of persons who are hospitalized with AstraZeneca, we have about 1,400 persons out of 100,000 who would die from a clot in the brain because of COVID-19, as opposed to the few in a million who would have experienced that rare form of blood clotting with low platelets. So when you make that comparison, I think all of us still need to acknowledge, do we want to put ourselves at risk for getting COVID-19 and having that level of risk, or do we want to take the vaccine that could cause so much more of a benefit than a risk? So I know I'm kind of talking a lot, but go ahead, Doc.
Thank you. I'm happy that you pointed out the risk associated with actual COVID-19 infection. We have seen so far St. Lucia would have experienced some 4,504 confirmed cases and some 74 deaths. Each death is one death too many. We do know that COVID-19 is associated with the formation of clot, very significant formation of blood clots. And in addition to COVID-19, we do know that in the background, we have several other risk factors for formation of clot when you try to associate the AstraZeneca with blood clots, such as obesity,
right,
advancing age, tobacco smoking, the use of contraceptive pills containing what we call the estrogen, persons who may have cancers, persons with immobility, persons with a family history of blood clots and injuries, trauma. So all these are things in the background that can result in blood clot. And more so, if you look at some of the developed countries, all right, you have on average some 900,000 persons develop what we call venous thromboembolism, that is clots in the vein. And this is without the introduction of the vaccine. And some 100,000 or so die from blood clots each year in some territories. And so when you look at all this, and the risk when it comes to the AstraZeneca is less than 1 in a million or even more so, the benefits of vaccinating far outweigh the risk to really get us back, because we recognize that it is very tough on us as we need to implement these public health measures as wearing the mask, physical distancing, frequent hand sanitizing, the curfews, and all these restrictions. And we, as St. Lucians, we really want to get back to some level of normalcy. And to really achieve this, while we practice these public health measures, it is important that we really accept vaccination at every level possible, whether it is in the workplace, it is in the institution, it is in the community, or the country as a whole, so that we can reach that level of 70% or more vaccination to really allow us to really open up the economy, open up the activities, open up sporting. You're able to go to the cinema freely, you're able to move around freely, but all this can only be possible if we're able to bring the level of active COVID-19 cases down. We know it is challenging to get to zero, but at least if we can bring that figure under 50, we'll be able to open up some of these activities. And to do so, vaccination is a key strategy.
Even stepping out of the door every day is a huge risk. Taking a couple of sips of alcohol increases your risk for a number of organ cancers too. So I think sometimes, this is not to minimize anything else, but I think sometimes I would like our people to look into a lot of other things that are contributing to ill health, to clotting, like the obesity, poor diet, the consumption of alcohol. And it can really be an imbalance when the media is showing that a few persons in a million are getting clots from the vaccine, and we are not talking about the other side of the story, the high numbers of persons that's getting clots because of obesity, because of problems, contraceptive use, etc. So the safety depends on the risk, and obviously when we look at the risk, it's so low that we will have to conclude that it is a very safe option for helping us to fight. We are coming to the end of the program. Oh, this conversation has been so good. We didn't even notice the time is running out on us. So I'm just going to allow all the panelists to give some last words, final words from you, Dr. Ogunlusi.
Okay, so to the viewers, we have said so many things today, and if there is one thing I want everyone to go with, is that the benefits of the vaccination way it's more than the risk that comes with it. And like we have said, we have so many things to benefit from getting vaccination than not getting vaccination. So I am going to encourage every one of us to go and be vaccinated.
Thank you very much. Lucia Baptiste.
Okay, for me, likewise, I just want to encourage our citizenry to get vaccinated. Of course, as we celebrate Vaccination Week in the Americas, the theme is vaccines get us closer. We know that COVID-19 has come and it has stripped us away from all of our personal moments with family, friends, and you know, we're not able to socialize in the ways that we would have normally done. And in order for us to be able to achieve that level of normalcy, it's only if enough persons in our population, until we get vaccinated, until we get to that level of population immunity, then it is not going to be possible. As you said, Ms. Grandison, you know, having to wear the mask and having to sanitize all the time and keeping your distance, this is difficult. I don't think there's any getting used to it. I mean, we have to do it because we know this is the only way that we could protect ourselves, especially in a time like now. I just want to inform our public and our listening audience that in the coming weeks, we are going to be ramping up, for lack of a better word, the campaign. Of course, we started off in a phased approach, targeting persons at very high risk in the first phase. We are supposedly in the second phase, where we are targeting persons of medium risk. And with that persons in that phase, it's more of a targeted approach, whilst we also encourage persons to visit the vaccination sites. But moving forward, we see the need, because I think we all want to get to that level of normalcy. We want to get as close as possible to that population immunity, and as such, we encourage persons, and we are going to be moving away from just the phased approach, but at this point running the phase 2 and phase 3 concurrently, and asking persons, everyone who desires to be vaccinated, who are over the age of 18 and eligible for the vaccine, to access one of the vaccination sites around the island.
Thank you very
much. I just want to again say that the COVID-19 vaccine is what is going to take us to that level of normalcy that we are all looking forward to.
Thank you very much, Lucia Baptiste. Dr. Joseph?
Thank you, Mrs. Grandison. And I must reinforce what Dr. Ogunlusi and Nurse Baptiste would have highlighted. We have seen the benefits of vaccination in children. We have seen that vaccine is a very effective and cost-efficient way of managing infectious diseases. We have also recognized that really to have that benefit of vaccine, you need what is called a population immunity, where we have more than 70% in the case of COVID-19, more than 70%, and we're looking at some 146% number of persons in our population. Pardon me, 126 being vaccinated in our population. Thank you.
126,000.
126,000. But I want to say the vaccination program has been a success thus far, and we would like to ramp up the campaign so that we can quickly get to that level so we can open up. And just to leave you with, so far we have vaccinated 24,230 persons with their first dose, some 1,602 persons with their second dose. It means that for that first dose, we will be covering some 13% of our population, and we look forward to bring that number with both doses being administered to persons to over 70%. From the Ministry of Health and Wellness, I would join with you in saying thanks for the audience who have been listening, who have been participating, who have been providing their questions and comments. And we look forward to utilize those comments in strengthening our program, in reaching out to the persons who we need to continue capturing those information as it relates to side effects and adverse reaction, and to really ensure that our population is not only vaccinated, but also cared for through this journey of us returning to normalcy.
Fantastic.
Thank you.
I am very happy to hear that. Thank you so much, viewers, for joining us. Just some final closing words. We just want to remind everybody to think about the sources of the information. Always research the names of the person you're getting the information from, know who they are, and refer to the Pan American Health Organization websites, the WHO websites, websites that end with edu, or government-related websites to get valid sources of information. Apart from wearing masks, washing hands, and sanitizing hands, physical distancing, vaccines have been proven to be the most effective way to prevent and protect us from various forms of disease, including COVID-19. Let us take a stand against the enemy. If you can vaccinate, then do it for you, for yours, and for us. Thanks for joining us. My name is Naomi Grandison. Have a blessed day.